Hi, my name is Nga Yuan, or Yuan in short, and this is EFM, the Resource Center for all conversations on entrepreneurship in action. This is the Demo Day series where we are excited to speak to the most recent batch of startups under the University Malaya Deep Tech UMDT. Now, UMDT is a startup accelerator with the University Malaya Center of Innovation and Commercialization, UMCIC. Today, we are speaking to Scoltech, with the CTO founder, Dr. Lai Kin Wee, as well as Shazia Anis, the CEO. So Scoltech is actually a solution, or well, it is going to be very exciting when it is out in the market. So perhaps Dr. Lee Dr. Lai would like to bring us through it.
Sure. We started the project back in the year of 2017. We are actually collaborating with a group of surgeons from University of Malaya Medical Centers, and of course with a group of supports of my research assistants. And back in 2017, we managed to secure prototypes funds funded by the Ministry of Higher Education, MOHI, and then we completed the medical ethics approval. We also conducted 2 cycles of a clinical trial in the UMMC, and based on the clinical trial results, we received a lot of good feedbacks from the physicians and doctors. And it's also because of that, Shazia and I decided to continue validate the potential of this Scoltech under the UMDT program in last year, 2020. So right now we are ready for the next step to commercialize it. And hopefully by acquiring a few more medical certifications that is required for us to do the sales in Malaysia. Also, we are looking forward to have some engagement with distributors and partnerships for the sales in Malaysia.
So just to understand this product, Scoltech is actually a machine, or is actually a wearable? What is it?
It's a simple diagnostics devices for us to diagnose scoliosis conditions.
So it's a tool.
Not a wearable. It's a tool. It's a tool to not to say replacing the existing analog clinical tool in the hospitals, but we are hoping that we can provide a more accurate reading and also improving the efficiency of entire diagnosis process.
So what were the pain points that you were trying to solve?
The pain points, existing, if you understand the current technology that used in the hospital and also the practice by the doctors in different physiotherapy center and also the chiropractor centers, the gold standard tools is an analog tools which require manuals, adjustment and also calculations based on the angle reading to the centimeter or millimeter displacement. So our digital tool here will directly give you 3-in-1 measurements, which none of the existing analog tools is available from the markets can do the same. So the 3 readings here, we have the shoulder height differences, and we have the angle trunk rotations, and also the last mode is the arm height differences. So these 3,
So it's a digital tool, and is it easy to use? What kind of training will the surgeons or the physiotherapists or the chiropractors require to take on or to learn before they are able to use this at an expert level?
The device has been designed in such a way that even a layman can easily use it without
Actually, we have taken up the same concept as the devices they have used. So they don't need any specific training. They are already using those devices. We use the same mechanism. It's just that they are analog and we have converted into digital. And also one of the other thing is like the existing technologies that they are using in the hospitals, they have like some of them depends on visuals, some of them are analog scales, some of it's a wide variety of data they are collecting. So with Scoltech, what we have done is like we are giving them numeric values, like what they are looking for. We translate it to the numbers, and they get to see the patient condition in numbers, which is easier for them to understand them.
So which means in addition to the tool, there's also a software that enables the data to be captured of the patients and be translated so that diagnosis can be made a lot faster and easier and more accurate, most importantly. Is that right?
Right.
Yes.
Okay, so can we just very quickly talk about where we are now in terms of commercialization? Are we getting approval? What TRL are we at? Are we at, when you're talking to distributors, are we talking about IP sharing already? What are we, where are we?
Okay, regarding commercialization, actually, since it's a medical device, first step is for us to get the certification.
Yes, absolutely. How far away are you from
yes,
that?
there is like a long list of certifications we need to get into, and obviously each certification needs its own funds.
Yes, it's true. How much time are you projecting that you will need before we actually do see this in the market?
Actually, if what we are targeting at is we are targeting at certain specific funds which we want to pitch for, and hopefully we get accepted. So as soon as we get the funds, we will you can say like 6 to 8 months.
6 to 8 months. So
Yes.
we're imagining plus the funding process,
yes,
like a year thereabout.
Yeah.
Okay, it's looking really exciting, and I'm quite sure it's going to come as a great solution, especially in the diagnosis of scoliosis in many different patients and people. Thank you so much for this session. I really appreciate it. All the best in your journey. Good luck, and we will direct, or well, anyone who's interested to get in touch with Scoltech, please do so ASAP. And I'm quite sure you are ready to talk with whoever who is coming your way, right?
Yes.
Okay, looking forward.
All right.
Thank you very much,
so much.
Adia and Dr. Lai.
you.
Thank you.
Thank you so much for your time.
Bye.